Welcome to Living, Breathing, and Having a Good Time. I'm your host, Sierra, and today we have a very educational guest, and I'm so excited to announce her. She is an advanced nurse practitioner with a master's in nursing and is board certified in functional medicine, which is very important. She specializes in regenerative medicine, owns her own practice at Younger You Med Spa. Today, Quindone, thank you for being a guest. You have so much to tell us about. You've been in school most of your life,
Pretty much.
and you look
We're going.
fabulous. And a lot of people, when they see an individual like yourself walk in a room, they think, oh, how can we look like this? Because you're literally the face of your
I
business.
wouldn't say that. I do try my best to keep motivated because, like you just said, I'm a walking advertisement.
You are.
But I think the most thing that I find that I feel I need to do is just more of just for my own health in general. I see so many people working in the medical, in the hospital and stuff. There's so many people that are young, still
Yeah.
suffering
Yes.
with cardiac disease, high blood
It's
pressure.
sad.
And
Yeah.
the things that they really understand, there are some genetic components to it. There's no doubt about that. But our genetic components don't turn on until we add those bad things into our lifestyle.
And a lot of people that I've interviewed, we talk about diet, we talk about exercise, we talk about water intake.
Of course.
You know,
Important.
and you're dealing with people's skin
Right.
every day. You see, I can't even imagine the bad skin that you see. And they're like, here, turn me in.
Most important thing from that taking away, even if you don't do anything else, sunscreen is like the number one thing that I always try to convince people to use. And I think a lot of people are misconceived that they say, oh, until I go out in the sun, that's when I put sunscreen on, which is not true because you have to protect your skin always from the sun, even when you're driving in the car to go to get grocery.
Now, and a lot of people want to use organic. Do you use an organic line of sunscreen? What's your go-to?
Honestly, there's not a, if you have organic, of course, that's better. We don't want to introduce any more chemical, but again, all our lives are surrounded by chemicals. So there's
We are.
to pick and choose of what we want to use.
Right. Yes.
The most ones that I think that are that people feel that are poisonous to us is really even our daily. And some people, I don't know. I have lots of people that have those plug-ins air freshener.
Oh, those are so bad.
You know, there's chemicals, so it's worse
Yeah.
than putting like not a non-organic sunscreen on you.
It
Sunscreen,
is.
it does protection. I can't say 100% organic is going to be the best way to go using product wise, but I would say organic in terms of food is probably the best way to.
So you have this medical spa in Inglewood, Florida
Yeah.
called Younger You. Tell us a little bit about it.
So I started probably about, technically I started about 10 years ago, but having my own business, running my own place, probably about 5 years. And then the first year and a half, I would probably say it was really good. And we are building more and more clients as the work. But I felt like I didn't have the results that I was looking for. As well as I know, Inglewood has a higher demographic of older people.
Oh, yes.
Over the age of 65.
Yes.
So I'm not getting them when they're 30s or 40s so that I can really do a lot. But in terms of people that get results, they still get really fabulous result depending on now that I learned that it's how their habits are, what they eat, they exercise, all those things. Really
Drinking,
help.
smoking.
Those things help in terms of what I can get in terms of result because technically I'm only using superficial product, but the things
Right.
that are inside of you causes all these superficial products not to work.
Now you're doing injectables, you're doing Botox,
And
and you just, and lasers, and you just went for training up in New York for,
That's we're actually moving. We're learning more that we don't want to use just fillers and Botox like we've been using before. We want to gear people into making their body heal itself. And there are different ways of doing it, especially with laser. It's causing the collagen production to reduce. With the injectables that we have now, they are called biostimulator, which actually interacts with your tissue and causes your tissue to actually produce elasticity and produce its own collagen and fibroblasting.
which we need a lot of that.
If you maintain, let's say, for example, someone that comes in at the age of 40, they obviously don't need as much, but if their diet is good, they can even be longer for
Yeah. Yeah.
that results.
Yes. And do you see in today's society, do you see, because of the processed food, the fast food, the convenience issue,
Right.
because people are stressed, because people are not sleeping well, do you see at a younger age a decline in all these
Yes,
things?
absolutely.
Okay.
I think in some cultures a little more. But I
Yes.
think that's what you grew up knowing, and I really truly believe if we, as adults, our parents, lead the way, show them the way, then your kids will automatically switch that way because they see that you're doing it.
Now, you moved to Florida from Vietnam when you were 5.
Yep.
And so your diet, and we discussed this briefly, so your daughter's pretty good about it, and your husband's gotten better over time. Mainly vegetables
Yes.
for the most part.
For the most part. And then it's really, I want to emphasize the word whole vegetable.
Okay.
Not vegetables that come in a can. Vegetables
Yes. Yes.
have been processed already. Because the more of the fresh vegetable you have, the more nutrients it can help you with.
What I was going to say is I scroll on Facebook and then I come across these wonderful things that you cook. And it's very interesting. So a lot of ginger, a lot of turmeric, a lot of...
Yes, we eat a lot of herbs naturally, like mint and basils. That's like our
Oh,
the things
so
we eat
good.
fresh. And I think it's incorporated into our food naturally because that's I like my taste buds like. Cheese, I don't eat a lot of sugar.
Me
A lot
either.
of fry.
No.
Not because when I was growing up, I didn't
Yeah.
know that it was bad for me. I just knew that's what I didn't
You know what?
because that's what my parents never fed me.
Yeah, exactly.
And I think that said a lot, especially with soda too.
Oh,
If you go into and you know just how many children,
are
should
drinking
drink
soda. It's insane.
not perfect. Let me just tell you that for all intensive purposes. I drink soda. I would probably order a soda when I go out to eat somewhere at a restaurant. I would probably take a sip or two. You will never
Right.
see that my whole glass is
No.
so I think that's one of the things that people don't realize. Soda can actually, there is actually a study out there that if you drink 20 ounces of soda, you actually age 4.5 years.
Wow.
These sodas.
Wow. That's insane. So now with your practice, with all your education that you've acquired, you found this just on the whim or do...
Accident, not by accident. I was really curious. I started, like I told you, about a year and a half into my field. And some patients came back with really good results that they can go longer and they still have the results even after 2 years. There were some patients that I encounter that I would probably say 6 months, 8 months, and we have to do treatment again. And they keep saying the word, oh, it just burns out of me. And then I wonder, I'm like, what the heck are they doing that's burning out of them? So then I went back into collecting data, basically reading their health history, seeing what kind of lifestyle. And the majority of the people that I found that were doing good, they can exercise, they don't really eat a lot of sugar. They're in a good diet position, whole food, a well-balanced diet. I'm not saying that they cut out everything because that's not
Right.
either. But they have a pretty much well-balanced diet that actually helps them maintain the procedure, the treatments that I've done for them. So I found out that eating sugar was like one of the worst things.
Because since the skin is your largest organ, when you say some procedures that you do, it really draws a lot of that inflammation up to the surface. So I'm sure for a lot of people that are very unaware and disconnected from their body, they're probably a little shocked. They're probably a little surprised.
We tell them for that no matter what you say, I still get a text 2 days after.
Yeah.
Yeah. It's like so swollen.
Yeah.
Naturally, your body has to go through an inflammation stage in order to repair itself. That's just our natural process of how we heal.
Yeah.
And aging is part of that too. We do age slowly, but I think when we eat foreign things, chemical, ultra processed.
Yeah. Yeah.
Causes your body to go into an inflammation stage like continuously. So then it doesn't know when to stop. It also has a lot of things like where your body is continually, your immune system is continue fighting to fight this thief and doesn't know what to do at some point. So if you've been, like I just said, drinking soda as a young age,
Yeah.
your body is continually trying to fight this formed sugar, break it,
Yes.
your lymphatic system. But then at some point when you turn 40 or 50, you
Mhm.
don't do that anymore because it's weakened.
That and talking about age, hormones.
Correct.
You probably have a lot of women in this area, like we discussed, older, that are coming in with a lot of hormone imbalances.
Correct.
And your diet also affects your thyroid.
Yep, and your insulin.
And
also-
they probably have no clue when they walk through the door. They want these things done, but how that actually affects the outcome as well, correct?
Hormone is definitely one of the other things. And like I just said, insulin is also a hormone. Thyroid, we always know, okay, we could just replace it, right? How many people do you know already have some sort of thyroid,
Oh, a lot.
which I actually was influenced in the last a year and a half ago, diagnosed with hyperthyroid because of stress, all kinds of things component together.
Yes.
With hurricane. So
Yeah.
everything went together and it caused my hormone to go imbalance.
Yeah.
And honestly, yes, I did go see an endocrinologist because I needed help in that term. I was hospitalized actually
Oh, wow.
because it went so high. My heart was
Wow.
like 200 and something. And then I ended up in the hospital. Of course, they have to fit you to an endocrinologist, which I definitely believe in working with another doctor, specialist,
Sure.
to manage my symptoms. So they did give me some medications at some point. The recommendation was to get thyroid. First, they got an ultrasound to see if my thyroid was off kilter, it was swollen. So they actually advised me to go get thyroid surgery, which
Oh.
I believe in.
Mhm.
I just know our body.
Did you have nodules?
Just
Okay.
maybe a little bit of I
And-
would probably say it like a minor knot. You couldn't even feel it. You had
Okay.
to go through an MRI to even see it.
Oh, wow.
And I
Okay.
think most of the inflammation is from my stress level. So in order for me to actually manage it, I do take the medications as they recommended, but less of what they
Yeah.
recommended. And I actually alternate my diet to help regulate it.
Mm.
So right now, I don't have any medications that I'm taking, and I don't need this. And
That's great. That's great. So it didn't affect your swallowing or, okay. And so, what would you say the biggest thing for people that are in that age bracket? What should they be looking for procedure wise?
I wouldn't say procedure. I think the first thing we need to know is for sure can lab work to make sure if we are in balance.
There you go.
100% of women lose their estrogen level as they.
Oh, yeah.
I mean, that's
Absolutely.
100%. There's no numbers that can say that, but some lose a little more than others. And there's things that you can do intervene by your diet, like I just said, eating like broccoli, spinach, green tea, for example. All of those things help elevate your estrogen naturally without having to actually take anything.
Now you do IV therapy as well. Yeah.
And IV therapy is really for older people. I would say they don't have absorption or they don't eat as much. If you notice, like my parents, for example, the older they get, the less the meal, even the meal that they eat.
Oh,
is
they
less.
do. Yeah.
So they can't get all the nutritions that they need from really food is really our main medicine that we should be using. But
Agreed.
as the older you are, the less absorption and the less food that you intake, then IV therapy is a solution for that. And we can infuse the vitamins that you need. And it does last about a month to a month and a half.
Okay, so you do give them kind of a step-by-step protocol plan of,
But sometimes people just want the results. And
yeah, that's why,
what I do is I try to educate them as much as I can, but do they listen and comply?
that's why I asked you the procedure question, because you see a lot of people in a younger age bracket coming in for all kinds of Botox and all kinds of procedures.
Yes.
Do you recommend that the younger kind of stay away from some of that for an elongated period of time until they reach a certain point? Or,
I say not necessarily all things, fillers for sure.
yeah,
To say there are so many different components, different procedures that give you the same results. especially back in what, maybe about 6 months, 8 months ago, lip fillers were really
Yeah, yeah. So,
there's little people weed out of that. But that I find a lot of young people starting. Older people don't necessarily care about that per se.
yeah.
They might care about those wrinkles above their lips, but not necessarily the volume of their lips. But the younger girls, 18, 16, they want the bigger lips. And it's a trend.
It is a
It-
trend.
it's just
Yeah.
and they do get off. The trend does fade off, which I'm finding it now more and more.
Yeah.
It's just Botox. I don't think that is necessarily needing to wait. I would probably say Botox is one of the things that you can start a little younger. But what happens if you start younger is you use less, first of all. Second of all, you can go longer. And the reason
Okay.
is because you're trying to prevent those lines from producing. In fact, waiting until you're 40 or 50 where the lines are creased already.
Right.
If I fold a piece of paper and I put a crease in it, what happens to it even if I open it? I still see
Right.
the crease. So these younger girls that are starting younger, they're just preventing that crease from formating it at all.
Okay. And so just because there's a lot of controversy around injectables and fillers and all this kind of stuff. So what's your take on that? What's your advice with all of that?
I don't want to say that I don't completely use fillers because there are so many different types of filler out there. And there's different ways of using fillers too. It's not
Okay.
necessarily just using it to plump up the area. I use Radius, for example. It has a calcium base. And if you hyperdilute it, it actually induces collagen.
Oh,
So I'm
okay.
still using the filler, but I'm just using it in a different method to induce your body to do collagen. So you get both the
Yeah, I think a lot of people ask, what exactly is filler?
there's two types, not two types, but basically there's a general type, which is the hyaluronic acid, which is synthetically made, but it does match our body. So the reaction people are afraid of allergic reaction.
Uh-huh.
It doesn't necessarily happen. Maybe 1% just and they have to put 1% because of legality.
Right,
Just like anything
right.
else that you do.
Yes.
It's to mimic your own body's hyaluronic acid.
Okay.
So what happens is we put the product in there, it draws fluid to that area to plump up the fluid in your body to plump up that area that we just injected with the hyaluronic acid.
So the other thing too that I see a lot of people doing is they cake on makeup. And so when I say that, you see a lot of these really beautiful young ladies that are just putting tons and tons of makeup on. And you have a really cool setup, actually, because I've been there. You've worked on me, of seeing where your skin health is. And it's amazing when you think you clean your skin. And then you go into your office and you find out, wow, you've got all kinds of microbials and bacteria. So tell us a little bit about, why people should stay away from wearing so much.
I think honestly, we can't tell them that because even at this age, if you watch on TikTok, what do they teach you?
Oh, they do. Tutorials.
Yeah, all the girls have the tutorial how to put makeup on.
Sure.
How many of us have ran into that just scrolling down social media somewhere? I think it's more of a mindset of, what society has shown them. And I don't think it has anything to do, but I have to say, if you have good skin, let's just say you don't have any pigmentations or you don't
Yeah.
have any kind of redness, then I think a lot of people choose not to wear makeup. I find that a lot as we get older too.
Yeah.
They are more refined. But the young girls, I have to say, it's more of a trend than
Yeah.
anything else. So it's a little hard to tell them.
Your skin's your largest organ. So was really surprised just to see where my skin was at when I walked in. So what would you suggest to people? Because I was shocked. I thought I was using all this great stuff on my skin. How exactly do you really keep your face clean? Really, just overall? Because I think we do stuff on a daily basis that really clogs our pores.
In our natural environment, honestly. If you have oily skin, for example, right?
Yeah.
And you just walk out into this environment and you're just talking about
Yes.
pollen, right?
Yes,
And-
I have allergies so bad today.
No, pollen. Even the pollen in the air, our environment, it always sticks into our pores. And if you have
Yes.
oily skin or big pores, it actually
Yeah.
gets into there more. I would have to say the best things that you can do for yourself is really not putting your hands touching your face.
I know, I can't help it. I have allergies. So,
Touching our face frequently is one of the things that people do
yes,
that kind of cause that.
I agree.
The other thing is trying to, like, I would say using like well, no, it's just the mind.
You have a lot of information up there.
There's a word now I can't think of it. But anyways, to cleanse your face, wash your face frequently, like at least twice a day instead of just at least some people wash their face maybe just once in the morning and
Yeah.
that's it.
Yeah.
I would say washing it 3 times a day is a good thing too, just because if you're more oily, it actually helps get rid of those pollutants that you have been encountering even out in the air. Not necessarily
Exactly.
just your meat.
Exactly. And how do you maintain a youthful glow? Because I know
You eat.
Because I know the closer you get to, let's say you've got a really healthful, well-balanced diet, but you've had, and I never did, acne in the past, or you've had hormone imbalance throughout your life. Because I have a lot of clients that they've now graduated to that healthy diet, hydration, the whole nine, and they still struggle. They get on hormone therapy and stuff like that, but how do they maintain that just overall? Is it something, a lot of people talk about coconut oil, a lot of people talk about using some all natural just to help refine.
Everything that we do to our body is, I mean, our face or general our skin to help hydrate it and plump it.
Uh-huh.
Always going to give you better looking skin. As we get older, we get dried everywhere.
Yeah.
The older we are, the more dry we are. And just by, like you just said, hydration by drinking sometimes is not quite enough.
No.
We actually have to apply that hydration. And sometimes our body just does not absorb it.
Yeah.
Like I was telling you, when the class I went to in New York just recently, we are introducing peptides into our
This is interesting.
treatment plan. Just because that peptide, the one that we specifically use, are made from plants, which extracted from plants.
Okay.
And peptides are simply a communicator, like a communicator to the cell. Basically goes into your skin and tells your cell what to do.
Yeah.
So what we do is we infuse the peptide through microneedling, through after a laser treatment, or even sometimes injecting it with our biostimulator to tell the cell, your skin cell, to keep the hydration in your body, to get rid of some of those inflamed blood vessels, or to even make the skin thicker.
I realize the difference, but there are so many different treatments. Microneedling, the biostimulator. What's the difference between all those? Because
in terms of microneedling, that's the most less invasive. So for someone that is in between the younger ages, like you just said, acne, for example.
Yeah.
If they're young and they have acne problems or they have sunspots or something that young people have, we try to do just the microneedling because it's very superficial.
And it's not painful.
I know, because you numb yourself. We numb you all of it. It's almost, I want to say, a little scratch, maybe.
It is.
Maybe.
Yeah. It is.
With that procedure, it's superficial, but we're opening the channels so that the peptide can actually go into your skin cells and tell your skin cell what to do.
Okay.
The biostimulator is a multitude of products that we actually cocktail and then we inject it subdermally, which means it's only in the skin area. Low, not deep into the fat or not deep.
Okay. Okay.
So what it does, it also communicates into that skin cell to tell the skin cell to repair itself. And it gives you a little bit of volume because your body is actually inducing that natural.
So microneedling is more invasive.
No, the biostimulator.
Biostimulator.
The microneedling is the first. It's the least invasive.
Okay.
And then the needling, and then the laser, of course, the older you are. And then even at the age of 50, some people have so much sun damage that we have to do the laser because the laser actually resurfaces the dead skins on the surface, but it actually induces the deep collagen underneath the laser light itself to heal itself. And on top of that, we actually put a exosome, I don't know if you know what it is.
Yes, I do.
Exosome is like a stem cell product onto the skin because the exosome was actually FDA approved for burn patient. in the hospital.
Yes.
So what
Yeah.
that does, it actually helps to heal because technically when you do a laser, you're burning the skin, like maybe a second level or second degree burn. And then you put this mask on to help induce collagen production and skin healing.
And this is a really important point because there's so many lasers out there. Everybody hears about laser pain, laser for your face, laser for your body. What's the difference between just doing the microneedling and doing the laser? And like, why should people consider laser over that?
Okay, so laser is really like a deeper.
Okay.
The laser itself, actually, the beam of light, has a specific target. Like some targets the water, some targets the melanocyte, some targets your blood vessels. So it depends on what it is that you're trying to treat also. What we do is we obviously evaluate our patients and determine which laser is good for you. We have, I'd probably say, 5 or 6 different types of laser
Okay.
office, just because one does not work for everything.
Yes,
So
exactly.
the laser is actually for people that have more severe corrective
Damage.
Yeah.
Okay.
correctiveness. Microneedling to me is just more of a maintenance. So if you
Okay.
have hardly any issues and you're just trying to maintain, then microneedling is a best procedure. And of
Okay.
course, people that have had laser, I do recommend them coming in every, let's say, 6 months or a year to do the microneedling facials so that they can maintain the results that we already fixed.
Now, I know a lot of people talk about dermaplaning and Sculptra. Sculptra, it was interesting a while ago. I had a client. She had never had Sculptra before, and she just came from, I don't know, up in Tampa or somewhere. And she looked like a fish
Yes.
afterwards. So what exactly is that like another one where it just brings up a lot of inflammation?
Yes and no. So yes, the sculpture is a product, it's a bipolar, and it has little beads of products in there. And when
Okay.
you inject it, it's actually mixed with fluid, with normal saline. And when you inject the product in there, most of the swellingness is from the liquid.
It was scary. It was like, oh my gosh.
Away from the liquid, first of all, you're
Okay.
injecting a lot of fluid into your skin.
Yeah.
It's going to swell up, right?
Yeah.
The other thing is that because you inject this product in there, your body recognizes that it has to do something to absorb it. So therefore, your inflammation has just kicked in.
Yes.
On top of the fluid, you just had more inflammation to your skin, to your face. You're going to be more inflamed or swollen.
Yeah, she reminded me of a Disney character. I went, oh my gosh. You know?
But I'm sure
She looked fantastic afterwards.
if you sure you after about maybe 2 days later, it was
Oh, she looked beautiful.
Yes.
I was like, wow.
Yes, that's part of also biostimulated that I was talking about. Those two, the sculpture that you were talking about, that has been around for a long time.
Yes.
People have weeded out of that.
Okay.
Because
Okay.
it takes too long to see the results.
Yeah.
And then fillers is instant gratification. So then a lot of people have moved on to fillers and opted to do the filler because they don't have the swollen as a person.
And let me ask you something now. Does Botox ever quit working?
And not that it doesn't, not that it quits. I would say that your body builds a tolerance. Just the
Okay.
medication, even
Yeah.
shampoo, if you use the same shampoo
Yes.
continuously,
Yeah.
your body says, no, it doesn't work quite as well as it used to.
Yes.
Right?
Yes.
Same idea with Botox or any other brand of Botox, neurotoxin. We do at our place, in our location, we actually have several, only because even if you use Botox for, let's say, the last 5 sessions that you've had, we do want to introduce something different, like a different brand, because of the fact that your body does build a tolerance. It builds a protein, an antibody to fight it.
Sure.
I
Absolutely.
think people that exercise feel it does metabolize faster because it is a protein. So
Yes.
it depends on what type of Botox or neurotoxin that you choose. Although I'm going to tell you, there is a new one called Dexify, which has
I've heard of that. Yes. Okay.
which we are actually having it we are bringing it into our office only because
Nice.
it has a peptide that it communicates to the cell, the neural muscle cell, to stop working basically for a little while. It doesn't stay that way forever. I'd probably say majority of people get about 5 to 6 months from it. And that's a lot longer than what Botox is doing.
Now, just out of curiosity, as the year comes up, are you going to be introducing more body treatment?
We do have body treatments there already. We do have a machine called the Evolve. And then we also have, in combination with the Evolve, we actually do what they call it, Cavella injections.
Okay, Bella. Yep.
Cavella is FDA approved for subcutaneous.
Yeah.
Which basically was approved for double chin. Technically, we do it off label. You can do it on any area that is considered subcutaneous fat. Subcutaneous fat is basically fat that you can pinch.
Yeah.
Pinchable fat.
Yeah.
We do it off label because the manufacturer that produces Cavella, they cannot do all the studies of all the body parts to get it approved because it's too much
Gotcha.
money. And it would cost you guys much money because every time
Yeah.
you study, then the increase of the product, the price of the product does go up.
Now, Evolve, what's the
That's
difference
like
with
a-
Evolve?
it-
I haven't heard of Evolve.
Evolve has I don't know if you ever heard of EM, which is another.
I haven't.
It's just a muscular, it actually works in a muscular way where
Oh.
it targets your muscle or something.
Okay.
And you go in and lay down, they'll put this machine on you and run it for, let's say, 15, 20 minutes. It actually makes your muscles sore like you did 20
Yeah.
100 sit-ups.
Yeah.
When you
Oh, that's right. Oh, hey, why not? Yeah.
So that's what that machine technically does. And it also has another component in it, which is the radio frequency laser on top of it. So you'll
Okay.
feel this heat. So what that heat does, it goes deep into the muscle and it also creates your body to tighten the skin.
So how many, it depends on a person's body, of course, but because there was a radio show that I was listening to. It was a really good radio show. It was a radio show with a bariatric plastic surgeon.
Yeah.
And he was talking about, when people are saying, oh, cool sculpting doesn't work. He was like, what these people don't understand is the difference between cool sculpting and having a tummy tuck, literally, is that visceral fat. So this is more for people that just have like maybe 5-10 pounds of love handles.
I would probably say with all the procedures that we do, it doesn't necessarily use fat. You can't lower your cholesterol by doing
Now.
doing the Evolve machine. But what I can do if you are healthy, balanced person, but if you've been working out and you still have these love handles that won't go away, no matter what you do, then yes, this procedure is definitely for you.
Okay.
Or for an example, I had a C-section.
I do too.
Child.
Yeah.
And so underneath the scar, there's
yes.
right?
Yes.
So no matter how much sit-up I can do, it will never get rid of that setback.
Yes.
Underneath that scar tissue.
Yes.
So with that procedure, that actually helps and makes it go away.
Okay.
Oh,
Interesting. Very interesting.
so it depends on the patient. And when you come in for a consultation, that's the whole idea, for us to talk to you, see what your diet is like, how you're exercising, because those things are very crucial to your results.
Oh, sure it is.
Because if you're not doing anything and you think that you can come in and just live on the Evolve machine and then by the time you walk around,
I know.
unfortunately, you just can't do that.
There's a lot of people, though. It's that instantaneous gratification.
Everyone.
So, all in all, what would be, just to finish up here, what would be the 5 congruent things that people should know and understand very well about looking into like a med spa, coming into a med spa for the first time?
Probably say to come in and to get a consultation obviously is the best, because then we can get to know you.
Yeah.
And see how your diet and your habits.
Yeah.
Because those are the 3 things that I'd have to say that really makes a difference is how you eat, what you eat.
Yeah.
Your lifestyle choices.
Yes.
Or like cigarettes.
Yes.
And then of course the other one is exercise. Because the exercise actually is not just for physical, but actually for your whole health. And when you eat, even if you, let's just say, I'm not perfect in terms of eating.
Yeah.
I have shivers every once in a while.
Yeah.
I eat bad things every once in a while. But if I exercise, your body has to create what they call autophagy, which means that this cell actually destroys all the bad cells that you just ate and depletes it. If you are doing it, then that way it makes it easier for me to give you the treatment and the longevity that you are looking for.
Okay, very good. Thank you so much for coming on today. It's very educational. And I just out of curiosity, so if people want to find you, if they want to connect with you, if they want to get more information from you, come and see you.
They can always look me up. It's called a young.
Okay.
And make sure you put Inglewood.
Okay. Yeah.
Inglewood, Florida. We have a website. You can always go on there and just put your information in and request a consultation.
And so just out of curiosity, because I haven't been on your website, but can people really get on your website and really educate themselves and
Yes.
kind of look through and say, hey, I'm
The only
kind of,
thing that we don't have is what we were just talking about because I feel like I haven't updated it enough. And I don't feel like I am in the functional medicine component of it.
yeah.
I do try to educate them in that aspect because it really helps in terms of
You think you'll ever expand into that? You
Yeah.
think you'll ever expand?
I would love to have somebody else, another practitioner in there that only
Yes.
specializes in that because I have way too many things already on my
You do. You're
if-
very
if I
busy.
can add someone to another provider, I will. We do have general testing. Like, for example, some people come in and they have, like I just told you, have results and they just keep fighting it. And so we
Yes.
actually do a through sensitivity.
Oh, that's a big
And
one.
also,
Yes.
one is called an instant resistant panel. And what that does is just gives me a guideline that they already have been fighting this immune system. The immune system's already.
Just an interesting fun fact to share too before we wrap up is a couple of interviews ago, I had been talking about eating for your blood type, which obviously triggers. So for an O blood type, I love avocados, but that is something that I should steer clear from
That's what I'm saying. So
histamine.
not all food is just because your neighbor has good results from eating avocado.
Yes.
Whatever it is, doesn't mean that your body is gonna. It could be it'd be like critical to your body.
Toxic.
Yeah, toxic
Yeah.
to your body.
All right. Very good. Thank you so much for coming on. I appreciate it.